The morning sun filtered through the crystal windows of New Terra Medical Center, casting rainbow patterns across the sterile white floors. Zara walked through the corridors with nervous excitement, bubbling in her chest. Today marked her first day working in the human medical ward, and she couldn't hide her enthusiasm. As a member of the cetacean species from the distant Andromeda system, Zara had always been fascinated by the diversity of life forms across the galaxy. Her people were aquatic beings with smooth, blue-tinted skin and large, intelligent eyes that could see far more colors than most species. They had 3 hearts instead of 1, and their biology was completely different from the land-dwelling humans she was about to treat. For the past 5 years, Zara had studied xenobiology at the prestigious Galactic Medical University. She had earned top grades in every subject, memorizing countless facts about different species and their unique medical needs. Her professors had praised her dedication and attention to detail. However, all her knowledge came from textbooks, holographic displays, and computer simulations. She had never actually examined a living human patient before today. The head of the medical center, Dr. Rodriguez, had specifically requested Zara for this position. The hospital was expanding its interspecies care program, and they needed medical professionals who could work with patients from different worlds. Zara's academic excellence and natural curiosity made her the perfect candidate for this challenging role. As she entered the human ward, Zara marveled at how different everything looked compared to the aquatic medical facilities of her home planet. The beds were elevated platforms instead of healing pools, and strange monitoring devices beeped and flashed with various readings. The air felt thick and dry compared to the humid environment she was used to, but her species could adapt to different atmospheric conditions when necessary. Nurse Thompson, a kind human woman with graying hair, approached Zara with a welcoming smile. She had been working at the medical center for over 20 years and had seen many alien medical professionals come and go. Her job was to help Zara adjust to working with human patients and learn the specific protocols of their ward. "Welcome to our team," Nurse Thompson said warmly. "We're so excited to have you here. Your reputation from medical school precedes you. Everyone says you're brilliant." Zara felt a wave of pride mixed with nervousness. She had worked so hard to reach this point in her career, and she didn't want to disappoint anyone. Her species valued competence and dedication above all else, and she had always pushed herself to be the best at everything she attempted. "Thank you," Zara replied, her voice carrying the melodic quality common to her people. "I've been looking forward to this opportunity for months. I want to learn everything I can about human medicine." Nurse Thompson showed Zara around the ward, explaining the various equipment and procedures. Everything seemed straightforward enough. The basic principles of medical care were similar across species: identify the problem, treat the symptoms, and help the patient heal. The main differences were in the specific anatomy and physiology of each species. After the orientation, Nurse Thompson handed Zara her first patient assignment. "This should be a good case to start with," she explained. "We have a construction worker who came in yesterday evening complaining of severe back and leg pain. He was working on a building site when he felt something pop in his lower back. The pain has been getting worse, and now it's shooting down his left leg." Zara nodded, feeling confident. Back injuries were common across many species, and she had studied human spinal anatomy extensively. She knew that humans had a complex system of vertebrae, discs, and nerves that could cause problems when damaged or compressed. This seemed like exactly the kind of straightforward case she needed to build her confidence. The patient was a man in his early 30s with calloused hands and sun-weathered skin. That spoke of years working outdoors. He was lying on his side in the hospital bed, his face twisted with pain. When Zara entered the room, he looked up at her with curiosity, but no fear. Living in an interspecies society meant that most humans were accustomed to receiving medical care from alien doctors and nurses. "Good morning," Zara said professionally. "I'm Zara, and I'll be your nurse today. I understand you're having some back pain that's bothering you quite a bit." The patient nodded grimly. "It started yesterday at work. I was lifting some heavy beams, and I felt this sharp pain shoot through my back. Now I can barely move without wanting to scream. The pain goes all the way down my leg too. Zara made notes on her electronic chart, feeling more comfortable as she fell into the familiar routine of patient assessment. This was exactly what she had trained for. She asked the patient about his symptoms when they started, what made them better or worse, and whether he had experienced anything like this before. I'm going to need to examine you to better understand what might be causing your pain, Zara explained. I'll need you to change positions a few times so I can check your reflexes and see how your spine is moving. The examination started normally. Zara checked the patient's vital signs, which all appeared within normal human ranges according to her training. She tested his reflexes with a small hammer, noting that the responses in his left leg seemed weaker than his right. This supported her initial theory that he might have a compressed nerve in his lower back. As she continued the examination, asking the patient to move into different positions to test his range of motion and locate the source of his pain, something unexpected happened during one particular movement. Zara noticed what appeared to be significant swelling and inflammation in the patient's pelvic area. Her large eyes grew even wider with concern as she observed this development. According to everything she had learned in medical school, this type of sudden inflammation could indicate a serious medical emergency. Her 3 hearts began beating faster as she tried to recall what could cause such a rapid onset of swelling in this region of human anatomy. None of the conditions she could think of seemed to match what she was observing. The patient seemed unaware of what Zara was seeing, focused as he was on the pain in his back and leg. He continued to answer her questions about his symptoms, while she tried to process this unexpected development. Her medical training told her that she needed to investigate this immediately, as it could be related to his other symptoms or represent a separate, potentially serious condition. Zara's mind raced through the possibilities. Could this be some kind of infection, an allergic reaction to medication, a complication from his back injury that she hadn't learned about in school? The more she thought about it, the more concerned she became. Her species prided itself on thoroughness and attention to detail, and she couldn't ignore what appeared to be a significant medical find. She excused herself from the room, telling the patient that she needed to consult with the supervising physician about his case. As she walked down the hallway toward Dr. Rodriguez's office, Zara felt a mixture of professional concern and personal anxiety. This was her first day, her first patient, and she had encountered something that wasn't in any of her textbooks. What if she had missed something important in her studies? What if this patient needed immediate treatment for a condition she didn't recognize? The weight of responsibility felt heavy on her shoulders as she prepared to discuss her findings with the more experienced human doctor. Little did Zara know that this moment would become a turning point in her medical career, teaching her lessons about human biology that no textbook could have prepared her for. Dr. Rodriguez was reviewing patient charts in her office when she heard a rapid knocking on her door. The sound was urgent, almost frantic. She looked up from her computer screen and called out for whoever was outside to come in. Zara burst through the door, her blue-tinted skin slightly darker than usual, a sign of stress among her species. Her large eyes were wide with concern, and she was carrying a medical tablet with shaking hands. Dr. Rodriguez had seen many new medical professionals over the years, but she had never seen someone look quite this worried on their first day. "Doctor, I need your help immediately," Zara said, her melodic voice higher pitched than normal. "I have a patient with what appears to be a very serious condition, and I'm not sure what to do." Dr. Rodriguez set down her coffee cup and gave Zara her full attention. She had been working with alien medical staff for several years now, and she knew that different species sometimes interpreted human symptoms in unexpected ways. However, the level of panic in Zara's voice suggested this might be something genuinely concerning. "Take a deep breath and tell me what's happening," Dr. Rodriguez said calmly. "Which patient are you talking about?" "The construction worker in room 314, Zara replied quickly. "He came in with back pain, but during my examination, I discovered something much more serious. There's significant inflammation and swelling in his pelvic region, It happened very suddenly, right during the examination. Dr. Rodriguez raised an eyebrow. She had briefly reviewed the construction worker's case that morning and hadn't seen anything in his initial assessment that would suggest complications in that area. The man had come in with classic symptoms of a herniated disc, back pain radiating down his leg, muscle weakness, and reduced reflexes. "What kind of inflammation are you seeing?" Dr. Rodriguez asked, standing up from her desk. "Can you describe it in more detail?" Zara began explaining her observations with clinical precision, using proper medical terminology but with an underlying tone of genuine concern. As she spoke, Dr. Rodriguez began to suspect what might be happening. She had encountered similar situations before when alien medical staff worked with human patients for the first time. "Let me come take a look," Dr. Rodriguez said gently. "Sometimes a second opinion can help clarify things." They walked down the hallway together, with Zara continuing to express her concerns about the patient's condition. She had spent the past 20 minutes researching rare human diseases on her medical tablet, looking for anything that might explain what she had observed. Her search had only made her more worried, as she had found several serious conditions that could potentially cause sudden swelling in that area. "I've been through my entire database of human medical conditions," Zara explained as they approached room 314. "There are several possibilities, but none of them seem to match exactly what I'm seeing. Some of the conditions I found are quite dangerous and require immediate treatment." Dr. Rodriguez nodded thoughtfully. She appreciated Zara's thoroughness and dedication to her patient's well-being. It was clear that the young alien nurse took her responsibilities seriously and wanted to provide the best possible care. However, Dr. Rodriguez was beginning to suspect that this might be more of a learning opportunity than a medical emergency. When they entered the patient's room, the construction worker was lying on his side, still clearly uncomfortable from his back pain. He had been given some mild pain medication earlier, which had made him drowsy but hadn't completely eliminated his discomfort. He looked up at the two medical professionals with tired eyes. "How are you feeling?" Dr. Rodriguez asked the patient kindly. "Any changes in your symptoms since Nurse Zara examined you earlier?" "Still hurts pretty bad," the man replied with a slight slur from the medication. "The pain in my leg is a bit better than it was yesterday, but my back still feels terrible. I can't find a comfortable position no matter what I try." Dr. Rodriguez began her own examination. Starting with the same basic checks that Zara had performed, she tested the patient's reflexes, checked his range of motion, and assessed the areas where he was experiencing pain. Everything she observed matched her initial diagnosis of a herniated disc with nerve compression. As the examination continued, Dr. Rodriguez began to understand what had caused Zara's concern. During certain movements and positions required for the spinal assessment, the patient's body displayed normal physiological responses that would be completely unfamiliar to someone from Zara's species. What the alien nurse had interpreted as dangerous inflammation was actually a perfectly natural human biological reaction. The realization hit Dr. Rodriguez like a light bulb turning on. She glanced at Zara, who was watching the examination intently, still clearly worried about her patient's condition. Dr. Rodriguez knew she needed to handle this situation delicately. Zara was an excellent nurse who genuinely cared about her patients, and Dr. Rodriguez didn't want to embarrass her or damage her confidence. After completing the examination, Dr. Rodriguez asked the patient if he needed anything for comfort and assured him that they would have a treatment plan ready soon. She then gestured for Zara to follow her out of the room so they could discuss the case privately. Once they were in the hallway, Dr. Rodriguez turned to face Zara with a gentle expression. She could see that the alien nurse was still tense with worry, waiting to hear about the serious condition she believed she had discovered. "Zara," Dr. Rodriguez began carefully, "I think I understand what caused your concern, and I want you to know that your observation skills are excellent. You're very thorough and attentive to detail, which are wonderful qualities in a nurse." Zara waited anxiously for Dr. Rodriguez to continue, expecting to hear about some rare condition or emergency treatment protocol. However, Dr. Rodriguez continued, What you observe isn't actually a medical problem. It's a normal physiological response that happens in human males during certain types of physical examinations or movements. It's completely natural and not something that requires any treatment. Sarah's large eyes blinked several times as she processed this information. Her expression shifted from concern to confusion, and then gradually to understanding as the implications of what Dr. Rodriguez was saying began to sink in. "You mean this is normal?" Zara asked quietly, her melodic voice barely above a whisper. "Completely normal," Dr. Rodriguez confirmed with a kind smile. "I realize this wasn't covered in your textbooks because it's not a medical condition. It's just a natural biological function that your species doesn't experience, so you wouldn't have had any way of knowing about it." The blue tint of Zara's skin deepened slightly, the equivalent of a human blushing. She felt embarrassed by her mistake, but also relieved that her patient wasn't in any danger. Her 3 hearts, which had been racing with worry, began to slow down to their normal rhythm. "I feel so foolish," Zara admitted, looking down at her medical tablet. "I spent so much time researching dangerous conditions, and it turns out everything is perfectly normal." "Don't feel foolish at all," Dr. Rodriguez said firmly. "Your response shows exactly the kind of careful attention and concern for patient welfare that makes a great nurse. It's better to be overly cautious and ask questions than to miss something important. This is just a learning experience, and now you'll know for future patients." Zara nodded, feeling grateful for Dr. Rodriguez's understanding and support. She realized that despite all her academic training, there were still aspects of human biology and behavior that she would need to learn through practical experience. This incident had taught her that textbook knowledge, while important, couldn't prepare her for every situation she might encounter. As they walked back toward the nurse's station, Dr. Rodriguez began explaining some of the biological and cultural aspects of human physiology that weren't typically covered in medical school curricula for non-human students. She spoke matter-of-factly and professionally, helping Zara understand these normal human functions without making her feel more embarrassed about her initial confusion. The construction worker, meanwhile, remained unaware of the diagnostic drama that had unfolded around his case, resting peacefully in his room while the medication helped manage his actual condition, the herniated disc that was causing his back and leg pain. The next morning, Zara arrived at the medical center earlier than usual. She had spent most of the previous evening thinking about her first day and the embarrassing mistake she had made. Despite Dr. Rodriguez's kind words and reassurance, Zara felt determined to make sure something like this never happened again. She found Dr. Rodriguez in the break room, sipping coffee and reviewing patient files before the morning shift began. The older doctor looked up with a warm smile when she saw Zara approaching. With a determined expression on her face, "Good morning, Zara," Dr. Rodriguez said cheerfully. "You're here bright and early today. How are you feeling after yesterday?" "I've been thinking all night," Zara replied, settling into the chair across from Dr. Rodriguez. "I realize that my medical education, while thorough in many ways, has some significant gaps when it comes to practical human biology. I don't want to make another mistake like yesterday." Dr. Rodriguez nodded approvingly. She had hoped that Zara would approach this as a learning opportunity, rather than letting embarrassment hold her back. In her experience, the best medical professionals were those who could acknowledge their limitations and actively work to improve their knowledge. "I was hoping you might say that," Dr. Rodriguez said. "Would you be interested in some additional training sessions? I could arrange for you to spend some time with our human anatomy specialist, and we could go over some of the practical aspects of human physiology that aren't typically covered in standard xenobiology courses." Zara's large eyes lit up with enthusiasm. "That would be wonderful. I want to understand everything I can about human biology so I can provide the best possible care for my patients." Over the next several days, Dr. Rodriguez arranged for Zara to receive comprehensive additional training. The sessions covered not just the technical medical aspects of human physiology, but also the cultural and social contexts that influence how humans experienced and discuss their bodies. Dr. Chen the hospital's chief of human anatomy, became Zara's primary instructor for these special sessions. He was a patient teacher who had worked with many alien medical professionals over the years. He understood that different species had vastly different biological systems, and he knew how to explain human physiology in ways that made sense to non-human medical staff. The key thing to understand, Dr. Chen explained during one of their sessions, is that human biology involves many automatic responses that the person can't control. These responses can happen during medical examinations, physical activity, stress, or even random times throughout the day. They're completely normal and not something that requires medical attention. Zara took detailed notes, asking thoughtful questions about various scenarios she might encounter. She wanted to understand not just what was normal, but also how to recognize when something actually was a medical concern versus a natural biological function. In my species, Zara explained to Dr. Chen, our reproductive biology works very differently. We don't have these kinds of automatic physical responses. So when I saw what I thought was sudden swelling, my only reference point was the medical conditions I had studied in school. Dr. Chen nodded understandingly. That makes perfect sense. Your reaction was actually very appropriate given your background knowledge. The important thing is that you're learning now, and you'll be better prepared for future situations. Meanwhile, back in room 314, the construction worker was making steady progress. With his actual medical condition, the MRI scan had confirmed Dr. Rodriguez's diagnosis of a herniated disc pressing against a nerve root. The treatment plan included anti-inflammatory medication, physical therapy, and specific exercises designed to reduce the pressure on the affected nerve. Zara continued to be his primary nurse throughout his stay, and she found herself becoming more confident in her abilities as she applied her new knowledge. The patient appreciated her thorough attention to his care and her genuine concern for his comfort and recovery. The construction worker said to Zara during one of her regular check-ins, "I've been treated by a lot of different doctors and nurses over the years, but you really pay attention to details. You notice things that others might miss." Zara felt a warm sense of pride at this compliment, but she also reflected on how her attention to detail had led to her initial confusion. She was learning that being observant was important, but so was having the right knowledge to interpret what she observed. Dr. Rodriguez often stopped by during Zara's patient care rounds, not to check up on her, but to continue their ongoing discussions about human medicine. These informal mentoring sessions became a valuable part of Zara's education. One thing I've noticed about alien medical staff, Dr. Rodriguez said during one of these conversations, is that they often bring fresh perspectives to human medicine. Your thorough approach and willingness to question what you observe are actually valuable qualities, even when they sometimes lead to confusion. Zara was developing protocols and checklists for herself to use when examining human patients. She created a comprehensive reference guide that included normal variations in human physiology, cultural considerations for different types of examinations, and guidelines for when to seek additional consultation. Her fellow alien medical staff began to notice her extra preparation and attention to human-specific medical knowledge. Several of them approached her with their own questions about human biology, having encountered similar confusion in their work. "I think we need better training programs for all non-human medical staff working with human patients," Zara suggested to Dr. Rodriguez. "My experience shows that our standard xenobiology education doesn't adequately prepare us for the practical realities of human medicine." Dr. Rodriguez agreed completely. "Would you be interested in helping develop such a program? Your recent experience gives you valuable insight into what kind of training would be most helpful." As the construction worker's condition improved day by day, Zara felt more confident in her abilities as a nurse. The patient was responding well to treatment, his pain levels were decreasing, and his mobility was gradually returning. Physical therapy sessions were helping him regain strength and flexibility in his back and leg. "The physical therapist says I should be able to go back to work in a few more weeks," the patient told Zara excitedly during one of her visits. "I was worried I might have permanent damage, but everyone here has taken such good care of me," Zara smiled at this news, feeling proud of the role she had played in his recovery. She had learned so much during his treatment, not just about human biology, but about the importance of thorough patient care and continuous learning in the medical field. Dr. Rodriguez began involving Zara in discussions about other complex cases. In the hospital, she valued Zara's unique perspective and her systematic approach to problem solving. The alien nurse's different way of thinking about medical problems sometimes led to insights that human medical staff might miss. Your species' logical and methodical approach to diagnosis is actually very valuable, Dr. Rodriguez told Zara. Combined with proper knowledge of human biology, your natural analytical abilities make you an excellent nurse. As the week progressed, Zara found herself feeling more integrated into the human medical team. Her colleagues appreciated her dedication to learning and her willingness to ask questions when she was unsure about something, rather than seeing her initial confusion as a weakness. They viewed it as evidence of her commitment to providing excellent patient care. The construction worker was scheduled to be discharged soon, and Zara felt a sense of accomplishment, knowing that she had successfully cared for her first human patient despite the initial challenges. She had learned valuable lessons about human biology, medical practice, and the importance of ongoing education in healthcare. Her experience had transformed from an embarrassing mistake into a powerful learning opportunity that would benefit not just her own career, but potentially help other alien medical professionals working with human patients in the future. 3 weeks had passed since Zara's first challenging day at the medical center. The construction worker was now walking around his room without assistance. His back pain had reduced to a manageable level, and he was eager to return to his normal life. Watching his recovery progress filled Zara with a deep sense of satisfaction that she had never experienced before. "I can't believe how much better I feel," the patient said to Zara during her morning rounds. "When I first came here, I thought I might never be able to work again. The pain was so terrible I could barely think straight." Zara checked his chart and noted the steady improvement in all his measurements. His reflexes had returned to normal, his range of motion had improved significantly, and his pain scores had dropped from a 9 out of 10 to just a 2 or 3 on most days. "The physical therapy has really helped," she observed, watching him perform some of the exercises the therapist had taught him. "Your dedication to following the treatment plan has made a big difference in your recovery." During these weeks, Zara had also been working on something that was becoming increasingly important to her. She had been documenting her learning experience and developing training materials that could help other alien medical staff avoid the confusion she had initially experienced. Dr. Rodriguez had encouraged this project, recognizing that Zara's unique perspective could be valuable for improving the hospital's interspecies medical training programs. They had scheduled regular meetings to discuss Zara's progress and review the materials she was creating. "I've been thinking about this from the perspective of what I wish I had known before starting work here," Zara explained to Dr. Rodriguez during one of their afternoon meetings. "There are so many aspects of human biology and culture that aren't covered in standard medical education for non-human species." Her training materials cover practical topics like normal human physiological responses, cultural sensitivities around different types of medical examinations, and guidelines for when to seek consultation from human medical specialists. She wrote everything in clear, simple language that could be easily understood by medical professionals from various species backgrounds. "This is excellent work," Dr. Rodriguez said. Reviewing Zara's latest draft, "I think this could become a standard part of our orientation program for all new alien medical staff." Word of Zara's project began to spread throughout the medical center. Other alien nurses and doctors approached her with their own questions and experiences, sharing stories of confusion and misunderstandings they had encountered while working with human patients. Dr. Patel, a surgeon from the Rajal system, stopped by Zara's station one afternoon with a curious expression on his face. His species had a completely different approach to pain management, and he had been struggling to understand human pain responses and medication needs. "I heard you've been developing training materials for interspecies medicine," Dr. Patel said. I wonder if you might have some insights about human pain management. My species doesn't experience pain the same way humans do, and I sometimes have difficulty assessing when human patients need stronger medication. Zara was happy to share what she had learned about human pain responses and how they differed from other species. These conversations helped her realize that her initial confusion about human biology was not unique. Many alien medical professionals face similar challenges when working with unfamiliar species. The construction worker's discharge day finally arrived. He had packed his few belongings and was waiting for his family to pick him up. Zara came to say goodbye and to give him his final discharge instructions. I want to thank you for everything you've done for me, he said sincerely. You've been the most attentive nurse I've ever had. You really cared about getting me better, and it showed in everything you did. Zara felt touched by his words, but she also felt a bit conflicted about accepting praise for care that had begun with such confusion on her part. However, she had learned that the most important thing was not avoiding mistakes, but learning from them and using that knowledge to provide better care in the future. It was my pleasure to help with your recovery, she replied. I learned a lot from taking care of you, and that knowledge will help me be a better nurse for future patients. After the patient left, Zara found herself reflecting on how much she had grown during these past few weeks. Her confidence in caring for human patients had increased dramatically, and she felt ready to take on more challenging cases. Dr. Rodriguez approached her later that afternoon with exciting news. I've been talking with the hospital administration about your training materials, she said. They're so impressed with your work that they want to offer you a position, developing comprehensive interspecies medical protocols for our entire hospital system. Zara was surprised and honored by this opportunity. That sounds like important work, she said thoughtfully. If it could help prevent other medical professionals from experiencing the confusion I went through, I think it would be very worthwhile. The position would involve working with medical staff from various species, researching the specific challenges they faced when treating patients from different worlds, and developing standardized training programs to address these issues. It was exactly the kind of meaningful work that Zara had always hoped to do in her medical career. As she considered this new opportunity, Zara realized that her embarrassing first day had actually led to one of the most valuable learning experiences of her life. She had not only become a better nurse, but she had also discovered a way to contribute to improving interspecies medical care on a much larger scale. That evening, Zara received an unexpected message on her communication device. It was from the construction worker she had just discharged earlier that day. He had sent a formal nomination recommending her for the hospital's monthly Excellence in Patient Care Award. Nurse Zara provided exceptional care during my stay at your hospital, the nomination letter read. Her attention to detail, dedication to understanding my condition, and genuine concern for my well-being made a significant difference in my recovery. She went above and beyond normal nursing duties to ensure I received the best possible treatment. Reading this nomination filled Zara with a sense of pride and accomplishment that she had never experienced before. She realized that despite her initial confusion and mistakes, she had successfully provided excellent care for her patient. Her willingness to learn and adapt had ultimately led to a positive outcome for everyone. IMVOLVED Dr. Rodriguez was delighted when she heard about the nomination. This is wonderful recognition of your hard work and dedication, she said. It shows that your commitment to learning and improving has made a real difference in patient care. The nomination also included a request from the patient asking if he could bring his family to meet Zara and thank her personally for the care she had provided. He wanted his wife and children to meet the nurse who had helped him recover from what had seemed like a potentially career-ending injury. Zara was touched by this request and agreed to meet with the patient's family. It would be another new experience for her, as her species didn't typically form personal connections with patients beyond the professional medical relationship. As she prepared for this meeting, Zara reflected on how much her understanding of human culture and medicine had expanded in just a few short weeks. She was beginning to appreciate not just the biological differences between species, but also the emotional and social aspects of medical care that were so important to human patients and their families. 6 months had passed since that memorable first day, when Zara had experienced her confusing encounter with human biology. The medical center buzzed with activity as always, but now Zara moved through the corridors with the confidence of someone who had found her true calling in the vast universe of interspecies medicine. Her new position as Director of Interspecies Medical Protocols had transformed not just her own career, but the entire approach to alien medical training at New Terra Medical Center. The office she now occupied was filled with research materials, training manuals, and communication devices that kept her connected with medical professionals across the galaxy. The latest feedback from the Endorian Medical Academy is very positive. Nurse Thompson reported during their weekly staff meeting. They want to implement your training protocols in all their human medicine programs. Zara felt a deep sense of satisfaction, knowing that her work was helping medical professionals throughout the galaxy provide better care for patients from different species. Her comprehensive training manual, Understanding Human Biology, a guide for non-human medical professionals, had become required reading in medical schools on over 20 different worlds. The manual covered everything from basic human anatomy to cultural considerations for medical examinations. It included detailed explanations of normal human physiological responses, guidelines for recognizing actual medical emergencies versus natural biological functions, and protocols for seeking appropriate consultation when unfamiliar situations arose. Dr. Rodriguez often stopped by Zara's office to discuss new cases and challenges that arose in their interspecies medical program. Their professional relationship had evolved into a genuine friendship built on mutual respect and shared dedication to improving patient care. We have a new group of Vulcarian medical students starting their human medicine rotation next week, Dr. Rodriguez mentioned during one of their regular meetings. Their species has some unique perspectives on emotional responses to medical treatment that could create interesting challenges. Zara nodded thoughtfully. I'll prepare some specific training materials for them. Each species brings their own unique perspective and potential areas of confusion when working with human patients. Her research had expanded far beyond her initial focus on basic human biology. She was now studying the cultural and emotional aspects of medical care that varied dramatically between different species. Some alien cultures viewed illness as a purely physical problem to be solved, while humans often needed emotional support and reassurance as part of their healing process. The afternoon brought an unexpected visitor to Zara's office. A familiar figure appeared in her doorway, the construction worker, who had been her first human patient. He was accompanied by a woman and two young children who looked up at Zara with curiosity and obvious admiration. I hope we're not interrupting anything important, the construction worker said with a warm smile. I wanted to bring my family by to meet the nurse who took such good care of me. Zara stood up from her desk, feeling genuinely happy to see her former patient looking healthy and strong. His recovery had been complete, and he had returned to his construction work without any lasting problems from his back injury. This is my wife, Lisa, and these are my kids, Tom and Jessica, he said, introducing his family. I've told them all about how you went above and beyond to make sure I got the best possible care. The children looked at Zara with wide eyes, fascinated by her blue-tinted skin and the melodic quality of her voice. They had grown up in an interspecies society, but they had never met an alien medical professional before. Are you really from another planet? The younger child asked with innocent curiosity. I am. Zara replied gently. I come from a world that's mostly covered with oceans, very different from Earth. But I came here because I wanted to learn how to help people from different planets stay healthy. The construction worker's wife stepped forward with tears in her eyes. I don't know if my husband told you, but we were really scared when he first got hurt. He was in so much pain, and we didn't know if he would ever be able to work again. The care you provided gave us hope during a very difficult time. Zara felt moved by their gratitude, but she also wanted them to understand something important. Your husband's recovery was the result of excellent teamwork from many people, doctors, physical therapists, and other medical staff. I was just one part of that team. But you were the part that made us feel like someone really cared, the construction worker said. You paid attention to every detail, you asked thoughtful questions, and you made sure I understood everything that was happening with my treatment. As they talked, Zara realized that her initial confusion and extra attention to detail, born from her uncertainty about human biology, had actually resulted in more thorough and attentive patient care. What she had seen as a weakness had ultimately become a strength. After the family left, Zara spent some time reflecting on how far she had come since that first challenging day. Her office walls were now covered with certificates of appreciation from medical schools, thank you letters from patients and their families, and recognition awards from various interspecies medical organizations. Her latest project involved creating virtual reality training simulations that would allow alien medical students to practice examining patients from different species in a safe, educational environment. The technology would help them understand normal biological variations without the risk of misdiagnosis or patient confusion. Dr. Chen stopped by later that afternoon to discuss the virtual reality project. The programming team says they're ready to begin testing the first simulation modules. He reported, "They've created incredibly realistic scenarios based on your training protocols." "That's exciting progress," Zara replied. "This technology could revolutionize how we prepare medical professionals to work with unfamiliar species." As evening approached, Zara prepared to leave the medical center and return to her apartment. She had become a respected figure in the field of interspecies medicine, but she still remembered the importance of staying connected to direct patient care. She made a point of spending time each week working shifts as a regular nurse, caring for patients and staying current with the practical challenges of day-to-day medical care. These experiences continued to inform her research and training program development. Walking through the hospital corridors one final time that day, Zara encountered a group of new alien medical students who were just beginning their human medicine rotations. They looked nervous and uncertain, much as she had felt 6 months earlier. "Remember," she told them during an impromptu mentoring session, "the most important thing is to ask questions when you're unsure about something. No one expects you to know everything immediately, but everyone expects you to seek help when you need it." One of the students, a young physician from the Centauri system, raised her hand. "What if we make mistakes? What if we misunderstand something important about human biology?" Zara smiled, remembering her own fears and embarrassment from that first day. "Mistakes are how we learn, as long as we approach them with humility and use them as opportunities to grow. My biggest mistake as a new nurse led to some of my most valuable learning experiences." As she finally left the medical center and walked out into the evening air, Zara looked up at the stars visible in the darkening sky. Somewhere among those distant points of light was her home planet, where her family and friends lived their aquatic lives in ways that were completely different from the land-dwelling human she now cared for. Yet, despite the vast distances and biological differences that separated different species throughout the galaxy, Zara had learned that the fundamental desire to help others heal and recover was universal. Medical professionals from every world shared this common goal, even when their approaches and understanding varied dramatically. Her communication device chimed with an incoming message from the Galactic Medical Council. They were inviting her to present her research at the upcoming Interspecies Healthcare Summit, where medical professionals from across the known galaxy would gather to share knowledge and best practices. Reading this invitation, Zara realized that her journey from a confused new nurse to a respected expert in interspecies medicine was far from over. There were still countless species she had never encountered, new medical challenges to understand, and innovative solutions to develop. But she felt ready for whatever challenges lay ahead, knowing that her willingness to learn from mistakes and her dedication to providing excellent patient care would guide her through any future confusion or uncertainty. The embarrassing moment that had begun her career at the medical center had ultimately led her to discover her true purpose in the vast, diverse universe of interspecies healthcare.